Hi, guys. Welcome to Real Food Recovery. We are here today with a special guest and excited to have her. But I am going to say hello to Jamie, ask you how you're doing, and I'll let you do the introduction. So, how's it going, Jamie?
Excited to be here and excited to have Stacey Roberts. Stacey Roberts is our guest today. She is a PT, RN, and MSN who's with over 30 years of experience helping patients live pain-free while achieving their health goals. She's a holistic, master's prepared registered nurse, a musculoskeletal specialist, a pelvic and sexual health physiotherapist, and a functional medicine specialist. Stacey owns the New You Health and Wellness practice in Wauwatosa, Wisconsin, combining cutting-edge technology, advanced manual therapy, and functional medicine to help patients attain optimal health. Many of her patients, including herself, have avoided surgery, drugs, and injections. She's the author of the forthcoming book, The Pain-Free Formula, or I guess it's now current book, just released this week, The Pain-Free Formula, a holistic approach to finally getting rid of joint pain without surgery, drugs, or injections. You can discover more about Stacey at New You Health and Wellness, all one word, .com. All right, so Stacey, welcome. I'm very glad you're here.
Thank you so much.
Besides that, oh, go ahead.
I was saying thank you so much for having me.
Sure. Besides that awesome bio, can you tell us a little bit about how you found your way into this world? It sounds like, you maybe started in as an RN and then kind of morphed from there. Is that right?
I actually started as a physical therapist. So it was
Okay.
Oh,
back in 1990, I graduated from PT school. And then over the years, I worked with professional athletes, amateur athletes, done coaching, for athletics. Then, so I was a lot in sports medicine, orthopedics, did a fellowship in that, and then moved out to Australia. And due to some of my own health issues, started to get into more of the natural medicine over there. So I kept one foot in conventional, one foot in the natural world, complementary world, and really created some programs to combine the two safely so that people could utilize, a little bit of each if they need to optimize their health, move back to the United States. And then I was really wanting to expand my functional medicine background, but people had a hard time kind of wrapping their head around a physical therapist, understanding hormones and understanding those types, that type of physiology. So I went and got my nursing degree, and I'm close to being a nurse practitioner. I just need to find time to do my clinicals. But
Yes.
so then I expanded my scope of practice, opened my clinic, and I'm helping people with pain and hormone optimization, gut health, eating plans, all that type of stuff.
Yeah, there's so much to dig into there. What have you, I have had my own journey through this whole landscape that you're living in and practicing in. And what would you say has been over the last maybe 10, 15 years, the biggest contributor to it seems like myself and a lot of people I know have just tumbled down this hill of um, you know, all kinds of sort of confounding issues with their body. And
Mhm.
they used to call it, oh, it's aging, but now I'm seeing it happening earlier and earlier. So what would you say is really starting to impact people in these areas that you treat that has changed in the last 10 or 15 years?
Sure. I think the most surprising thing, I mean, hormones are a big thing because, and now that's kind of the trendy, but also valid thing to talk about in regards to hormones. But hormones do contribute to, or the transition through our life regarding hormone changes do contribute to increased pain. But really the most, I don't know if it's surprising, but it's just the newest. And I think really interesting is how our gut health, and therefore, like what you guys talk about, food, impacts our whole body, including hormones, including our joint health, including our brain health. And what's really interesting to me being in the Midwest is we usually don't get those concepts. Might start on the East and West Coast, and people talk about it, but then in the Midwest we're like, but now,
Yeah.
probably in the last 10, maybe in the last 5 years, when I bring it up, if somebody's not getting better with their localized pain, I bring up their gut, they're kind of leaning in instead of crossing their arms and leaning back. So really starting to understand that connection of how the gut and what we put in our body influences how we feel in the rest of our body, including our joints and muscles.
Well said.
We are interested particularly in that the pain area of our bodies because we work with people that suffer from processed food use disorder, and we know that stress, whatever form it comes at us, also activates that craving pathway in the brain. So those are so, but the stress and the cravings are so closely related, and pain would certainly fall under that stress category. So we mentioned that your book just came out, The Pain Free Formula. Is there something different, your approach to pain that helps control stress that might be different than the standard approach that's out there right now that might benefit people that also suffer from the ultra processed food use disorder? Because usually there's so many other comorbidities as with obesity and things like that, that pain is generally a part of their life as well.
Absolutely. So three things I think that come to mind, which I talk about in the pain-free formula, is hormones, which we mentioned, right? So that's really important. Gut health, which is significantly important because our gut, if we're under a significant amount of stress, so when I talk about hormones, I mean stress hormones as well as thyroid hormone as well as sex hormone. So it's all a bunch of that,
Mm.
and stress will impact all of those, right? So cortisol, when we're under a lot of stress, increases, our DHA decreases. DHA is our anti-aging hormone. And then when we're not in that stress mode, they balance themselves back out. But who's not in the stress mode these days, right?
That's right.
And then you add ultra processed foods into it, and that creates more physiological stress, compounding the emotional stress. So then our cortisol, our circadian rhythm, our diurnal rhythm, which is how our cortisol should be highest in the morning and then drop off so that we can fall asleep at the end of the night, that gets all messed up. So, and really when we go back to gut, which again is being supported in research all the time, these ultra processed foods impact the health of our gut microbiome in a way that they imbalance that to, I'll just simplify it to say bad bacteria versus good bacteria, although that's not necessarily completely true, but easy to understand. So when we eat those ultra processed foods, we have that imbalance of bad bacteria that then makes us crave more of those foods, right? So then you have the stress, the inflammation and stress from eating those foods, which
Mhm.
impact your cortisol levels. And then you have the stress and the inflammation impacting the microbiome. It's just this horrible, I don't want to call it a perfect storm, horrible storm that we have a hard time getting out of until we reset those habits and really change what we're putting in our body, and then add some other potential healthy supplements in to support that gut health in order to improve. And then the cravings change. Like it happened to me personally. I used to drink soda. I used to, I never was a huge processed food person in growing up, but we did do, occasionally the McDonald's and and when soda kind of started to become popular, like in the 80s and stuff. And that was hard because I would just crave it and crave it, crave it. But when I got rid of it and started to add, whole foods into my diet, things that weren't processed, those cravings gradually went away. So
Mhm.
I think a lot comes back to the gut, which makes sense. And then the gut has all these connections with joints, hormones, brain. So it's really important besides getting rid of the processed foods, to really recondition the health of the gut so that it's not a willpower thing. Many times it's more of your microbiome screaming out for the types of foods that it wants, and it can actually scream out for good, healthy foods too.
Yes.
So when you work with people that come to you for pain issues, you always address the diet?
So I always attempt to address the diet. So sometimes people come to me. We have a device called SoftWave. SoftWave is an electrohydraulic shockwave device. It is in 35 years of practice. It's the most effective reducer of localized pain. So if you come in, you twisted your knee, you have a little bit of a meniscus irritation. Meniscus is the shock absorber in between the knee bones. And there's inflammation there. This can knock that out very fast so that patients that I would used to need to see for 12 to 20 treatments are getting done in 3 to 6 treatments.
Oh, wow.
But if that technology and my manual therapy and my biomechanics that I work with to try to remove the irritation don't work, I have a discussion with the patients to say, look, this could be a bigger issue, right? So you should be getting better by now if it was just localized. Then if you're not, we need to look at the bigger picture, like hormones, diet, all that type of stuff. I do introduce that right from the beginning for most patients, because
Sure.
I think it's important for them to start thinking along those lines, in order for them to be accountable and empowered to take over their health as well.
Jamie, do you care if I just say one more thing?
Go ahead.
Fast? So uh, I'm an RN but I just practice, I don't practice in the hospital anymore, and I'm not active in my licensure anymore. So I have a medical massage practice in my home, and I saw a new client yesterday that 30 years of back pain, several back surgeries, inflammation, a special type of rheumatoid arthritis. So just severe pain all the time, just in very inflamed. And I said during the session, I said, have you ever, um, I know sugar is highly inflammatory. I just said, do you eat sugar? You know, are you interested in talking about that as well while I was doing her treatment? And she said, nah. So I was just going to bring up the point that compliance in that arena seems to be a bigger hurdle of convincing people, like you said, that it's all connected, and the gut health and all that.
Mhm.
But people really don't want to give up the stuff.
Yeah, that's the hard part, is there's a big disconnect between what we're putting in our body and how our body feels, right? So where I think honestly we're the beginning stages of teaching that concept. And it sounds, what on the other side of the line, it sounds like that's so common sense, right? But when you haven't really taken that on, as a part of your belief system, or really dug into the research and understanding the connection, and you really love those foods, right? We in our society, you guys know probably way better than I do, of the social connection, the comfort that we've conditioned ourselves to connect food to. Many people, I say to them, I won't say many, a few people, I'll say to them, if I could tell you that this food is the one that is causing your pain, would you be willing to give it up? And obviously, my thought of their response would be, well, yeah, but sometimes it's like, hmm. I mean, this could be people who've dealt with pain for 5 years, or on opioids, or having difficulty come off of, all these things.
Yeah.
And it just, right now in our society, there's a huge disconnect between that. So I kind of look at it as my goal to make that connection for people. Even if they don't do it with me, if I plant the seed, then hopefully down the line somewhere, they connect with somebody else, or they do their own research, or it's a part of, their plan to get better.
Yeah.
You mentioned you do meal planning. Uh, how how do you approach folks who come in with, and I guess, let's say that you have a patient who comes in and it's clear that they have issues in their gut, right? That they have leaky gut, right? Or they have, all of the issues related to maybe even SIBO or other bacterial or parasitic activity in their gut. And that was certainly my journey, right? Where it started showing up as joint issues, muscle issues, inflammation. Even though I was eating very, very low inflammatory foods at the time,
Mhm.
um, I was having severe pain, and I was having MCAS reactions to foods that I had eaten for a long time with no reactions. It was all of a sudden I was living in an autoimmune state.
Mhm.
Um, how do you approach folks who come to you with this maybe localized pain? And certainly I had a lower back issue during that time that was very acute that I really needed to get help with. So I went to a myofascial release uh, therapist, and he taught me, and outside of the visits, taught me how to care for my body in that area. But I had to go on this journey of healing my gut to
Mhm.
to alleviate the pain.
Mhm.
Um, and I chose something that was a temporary fix, which would look like a sort of keto carnivore style of eating. And now I'm shifting more into the, ketogenic, higher fat, incorporating lots of fiber and other things back into my diet now that I've got the clearance to do so. And I'm definitely noticing relief. But it took, Paige, what would you say, the better part of the last year for me to find what worked, to heal what I could. And I healed the gut, so I was told, but still had issues with SIBO and other things. So how do you keep patients engaged? Because this is not a short-term process. Maybe 3 to 6 visits fixes their acute pain, right?
Correct. Yep.
But what is really going to get to the root cause?
Yeah, I think the first thing is always meet the patient where they are, right?
Mm.
So they may have never heard of any type of connection between what they put in their body and why their body
Their
hurts.
pain, right?
But they may have heard of, pain with hormones or the menopausal transition or perimenopause. So if they're in that age category, I'll tap into that kind of common knowledge out there now, or maybe not common knowledge for everybody, but relatively large amount of information now about the menopausal transition and changes if it's a
Oh,
female,
yes.
and even for men too. So I try to make that connection based on where they are in their life. So then it kind of registers with them. Then then there's just a lot of education that goes into it. So I'm really starting to educate people from day 1 or 2, even if they're coming to see me for just that localized pain, right? So they hurt their elbow playing pickleball and we're treating that. I'm really starting to educate into all the other potential aspects, just so that, because usually what they'll say is, yeah, hurt my elbow playing pickleball. And the weirdest thing, my left shoulder hurts and that never hurt before. And you know what? My back is killing me. And so then we start to talk about, okay, well, if this just isn't a one-off localized issue, let's talk about what it could be. And then
Yeah.
again, they have heard that, they lean in a little bit more of that. But then the next step is tough, right? Because then as we talked about before, the whole conditioning that we have around food, when I start to bring up food, they could be like, oh yeah, I know I shouldn't have as much sugar, or I just don't know what to eat, right? People are telling me.
Oh God, there's so much conflicting information out there.
So what I've done is
Oh,
tried to
yes.
bring it down to an objective point of view. So I say, okay, so we've got 2 choices here, in my opinion. Now, if I feel like they've got SIBO, that will be looking at that next down the road. But first thing I want to do is get them to do a food diary for me for a week or 2 and a symptom diary together. So that's going to help me,
Beautiful.
see the potential connections, but more importantly, it'll help the patient see the potential connections too. Like on the days they have a better day, this is what they ate. On the days they had not so great day, this is what they ate. Then they can start seeing those connections. And then if that doesn't work, or if they don't want to do that, because then that's going to be, let's say, a guessing elimination kind of diet. Well, let's try to get
Sure.
gluten. Let's try to get rid of this, see if this is your issue. Then we'll do what's called the LCAT. So that's a test, that's a food sensitivity test where they
Yep.
take your blood and you've got the white blood cells from your blood that they then expose to the different types of foods. So then we get really specific objective data about how their body is reacting to certain foods.
Yeah.
Now, anytime we eat food, we have inflammation. There's no question about that. That's
Right.
how our body breaks it down. But when it's severe or moderate, those are the ones that are typically causing significant inflammation in the system, especially if they're having those on a regular basis. So then we look at eliminating those foods for 3 to 6 months, but really focusing on all the 100 or more foods that they can have, and then
Mhm.
start to do, make those changes. Now that can be very overwhelming for people if they have coffee and they have chocolate every day, and those come up in the severe moderate category. So then
Mhm.
what I tell the patients is, this is your information for you. So you could ease into it. You could go full bore, your personality. What do you want to do? How do you want me to support you through this process?
Beautiful.
And then if they step back and they're like, they started out good, but then kind of fell back, then we work together to go, okay, that's all right. We still have this objective data. So let's go and utilize this. And then we do a gut reconditioning program and slowly try to reset their gut as well, so they can add some of those foods back in. And it's
Yeah.
really interesting, the psychological part of it, because I'll
Oh,
say,
yes.
removing this food for 3 months, and they'll be like, oh, I can't believe I can't have that food. And I'm like, but it's only for 3 months. We're going to, add that back in, but like, I can't believe I can never have that food. I mean, it's really, really interesting.
Well,
One
we know.
into
We
those.
know it very well. That's all we do.
Right,
That's
exactly.
all we do.
Yeah.
We
So
work with the folks in that kind of way, and it's very strong connection to those
mhm.
foods.
Absolutely. But what's really cool is when they do it, and especially the severe and moderate foods that they're reacting to, and then in that 3 months is over or 6 months is over and they add that food back because they usually feel significantly better, right? It's generally overall better. And they add that favorite food back. Like one of my patients yesterday goes, you know what? I had no idea, but whenever I add a little bit of chocolate back, my ankle hurts. Now they would never have known
No,
that before,
exactly.
but now that
Exactly.
they've cleaned the slate and are starting to test things, then they go, oh my gosh, this is what was bothering me the whole time. I would have never picked that one thing out of that. And for some people it's chocolate, for some people it's blueberries, for some people it's, something that we think is healthy for us. For me, it was spinach.
Yes, in
you
here.
I had,
Really?
yeah,
Oh yeah, high oxalate.
yeah.
And if you have a problem with oxalates, it can be very, very irritating.
Yeah, for me, I didn't have any problem with any other oxalate foods, but I was having these weird, like my hands were aching so
Yep.
bad, like 2 hours after breakfast, and it didn't really dawn on me. And then I did the food sensitivity test, and spinach was in my severe category. And guess what kind of smoothie I was having every morning to
That
make me healthy?
I
so
have
many
that
of us,
every
yeah, so
morning.
many of us.
Yeah, I got rid
Uh,
of that, and immediately the pain in my hands went away. I've got so many stories about food and pain related stuff with my body.
yeah. What is I've heard of the MRT food sensitivity test. What was the acronym of yours that you use?
ALCAT, it's ALCAT, and actually the guy who invented the MRT invented the ALCAT. So there's all this little competition and things like that. So the MRT is great. The LCAT I have utilized for 15, 18 years. I find that to be great. And I think the ones that I just have a caution patients about are the IgG only tests.
Oh, tell me about it.
Yeah, exactly.
Yeah,
Because
they
everybody
were.
wants to do that because they're cheaper, but they're not giving us that right information. They're telling us more about what we can tolerate, not what we're not tolerating.
Or they're like I used a stool test for a sensitivity test, and it was all it was a mass marketing scheme to sell me supplements. It was just so disappointing, so disappointing. And it was actually the same prices as MCAT and AllCat. So or let me ask you a kind of a joke, but not really. Or MRT, sorry, not MCAT. This is kind of a joke, but I've noticed, is pickleball from your PT perspective, like put your PT hat on, is pickleball the new CrossFit?
Interesting. I haven't heard that analogy or that comparison
You know
before.
why I'm saying
Yeah.
CrossFit, not because of its benefits, right? Because it
Yeah.
seems like everyone I meet that plays pickleball has some sort of pickleball horror story of an injury.
Yeah, it is from an addiction point of view too. I don't know
Oh,
if it's
totally.
a strong word, but people, I mean, love, just like your people who are in CrossFit are like really
Oh
love.
yeah, zealots.
Yeah, the same with the pickleball. I see what you're saying, and I would agree that there's definitely a similarity
Something,
there for sure.
something going on. I mean, I love the community aspect. I don't play it, but I get invited all the time, and I'm like, stop it. I'm never ever
It's
gonna
so fun.
stop. I'm never gonna do it. You don't want me on your team. No.
So pickleball, how I look at it is pickleball is, CrossFit isn't, certainly not everyone can do CrossFit, the intensity, at least in my opinion, at the intensity that many people do CrossFit. But with pickleball, a lot of people can do it. But the problem is because they can do it, they forget that they still are moving their body and have to prepare to do it. So
Of
they get up
course.
there and their body is, tight from sitting, all this, and then they're trying to move in these different directions that they haven't moved into in forever. And let's just say my clinic sees its fair share of pickleball injuries.
Oh my gosh. That's why I'm saying the injuries that I hear about, not the severity of injuries, right? CrossFit was way more severe, but the severity of injuries that I hear about, the occurrence of injuries in pickleball reminds me of the days of CrossFit when I had PT friends be like, you stay away from any CrossFit box. I don't care how in shape you feel like you are. It's just,
Right.
you're so poorly managed.
It's an
Right.
accident waiting to happen.
Yeah, totally. So poorly managed. So there's, the community breeds this, this lack of humility that gets people injured. And I see this exact same trends in pickleball. So I was just, but to a lesser severity. So I was just curious what your thought was. Paige, go ahead.
I'm just still chuckling over that because that CrossFit was all the rage
Right?
for so long. As you were talking about, you said something a little bit about pain being psychological. And of course, we work with people that struggle with food cravings, and we have to get to the bottom of that. So there's a lot of psychological things going on behind. It's not just, I want a donut, there's something behind that. So thinking about that line of thought, do you have people that come in that the pain really is just psychosomatic and you do have to peel back the layers to find out what is actually going on, that there's not really an injury per se, that it's more between up in the noggin?
So, so if you listen to Lorimer Mosley, who's a who's a PhD instructor from Adelaide in Australia, he talks about pain a lot, and he says all pain, no matter what we experience, acute, chronic, whatever, is in the brain. And technically, he's
Ooh.
right? Because it all
Or
is
the
processed
senses, right.
in the brain, right? So do we have pain in our elbow? Yes, but it's really being processed in the brain as pain. So and then some other newer research is looking at the biopsychosocial model, right? Where let's say for example, I have pain in my back, but my back looks fine. My back's been fixed in surgery. There's no inflammation in my back that they can find. Then the biopsychosocial model says, okay, well, what else is going on, that could be contributing to it from a more holistic standpoint, biologically, psychologically, and even socially, right? We know that depression, anxiety can be associated with higher levels of pain as well, too. So there's a whole big area of research in regards to that. I rarely see somebody who I would say it's only psychological. There is usually, but again, I'm a little biased because I'm always looking at the biomechanics being a PT. So I will always usually find something that can be worked on, right? From a
Yeah.
PT standpoint. However, if you look at the research on chronic pain, we do know that even if there isn't inflammation in the area where somebody's feeling pain, the person does have some brain changes, like from neuroplasticity in the brain, the neurological connections can change.
Yeah.
We kind of wire our brain to protect ourselves from having pain when we've had it for a long period of time. The brain kind of goes into overdrive and overly protects us. We become more hypersensitive to pain, very similar to what happens when we take NSAIDs for a long period or pain meds for a long period, and those wear off and we become very hypersensitive. We feel the pain worse, even though there's less inflammation or potentially no inflammation there. So there
So
definitely are
interesting.
brain changes that happen that we can then rewire through things like cognitive behavioral therapy, other therapies to really change our thoughts and beliefs around that. I'll give you an example of the one that sticks out, and I think I write about him in the pain-free formula in regards to the psychological only aspect. He came in with his mom. He was probably in his early to mid 20s, still living at home. Mom was doing most of the talking. He said he tried every single thing for his back pain. And we did soft wave, and usually 90% of people that we do a soft wave trial with have some reduction of pain. It may not go away completely, but if it's localized, there was a significant reduction. He had no reduction in the pain with doing soft wave. So that was the thing for me to be like, okay, there's something else going on here. So he comes back the next time because I'm like, okay, well, let's go over some exercises. Let's do some manual therapy. Let's see if we can create a program together. His mom didn't come that time. And I had a really good talk with him, just one-on-one, and talking about what was going on at home and with school. And as soon as we started talking about certain things in regards to his family, he grabs his hand unconsciously and starts grabbing his shoulder and where his pain was. And I'm like, interesting. Do you notice that when we're talking about these things that your pain increases significantly? So he was having a reaction of, suppressing a lot of his feelings and issues with being at home. We did need to work on his diet for sure. But really, when he finally made the connection that this was actually what was contributing to his pain, it gave him the accountability and empowered him to be able to make changes in his environment. And I remember, I think I saw him one more time after that, as his mom wasn't really happy with the conversation that I had with him when we weren't there. But a year and a half or 2 years later, I got an email from him saying his pain's completely gone. He's finishing his master's, doing really well. And he just wanted to say, what we talked about helped him to see where that pain was really coming from, and that put him on a road to helping himself. So that was one that I would say was probably a very good amount was related to the psychological aspect, and just again, but then it's still always related to physiological, right? Because that will affect his cortisol levels, that will affect potentially his gut health, all those types of things were probably at play as well. So I don't think we can only say it's ever a brain thing. There's always that physiological connection as well.
Yeah, and that just makes me think so much about the people that we work with because, like I said before, it's never just cravings. We got to look at the big picture too when we're working with people with food addiction. We can't just say, don't eat those processed foods anymore, and that's all you need to do. That's
Right.
why in our program at Real Food Recovery, we have 16 branches that we have people focus on. I mean, yes, food, but spirituality, movement, stress, sleep, relationships. I mean, all those, it all plays into it. People are never just having cravings, and there's reasons that they're numbing out. So keeping that big picture in mind, I think it would be the same approach as somebody with pain. So I
Absolutely.
think that's so interesting.
Mhm.
I bet that patient you're talking about, you mentioned completing a master's degree. I wonder if he moved out of his home and
Mhm.
that's why his pain got better, or one of the
Yeah.
reasons why his pain got better.
I'm pretty sure he did, and well, the main thing that he said in there is he had to just work on his boundaries around himself,
Oh, yeah.
where he wanted to go, and not kind of being stuck in what the family wanted him to do.
Oh,
Um,
of course.
yeah,
If
he really
if
realized.
mama was trying to control you as a provider, right? And could you imagine what she would do with her children?
Right. Yeah.
I do a lot of work in recovery with folks, and I don't have a history of alcoholism, or alcohol abuse, but for me, it was, acting like an alcoholic around processed food.
Mm.
And I do a lot of work and, boundary work and recovery work, coaching around boundary setting and codependent recovery and, a lot of adult children, and even our own adult children dealing with, their birth mom who is, if they have a lot of unhealed trauma, a lot of unhealed wounds, they put those on their kids. The kids start to internalize everything, the kids' health fails
Mhm.
or starts to fail at 18, 19, 20 years old. It's very
Mhm.
sad to watch.
Wow.
Uh, and I love that you look at the holistic part of your patients and what their whole lives are like. Um, Tell me, you mentioned a little bit about the menopausal transition. We have a lot of women that are in our group that are in that mid to late 40s, early 50s. And, even myself, I've noticed, I don't know if I see these ads on social media. I don't know if this is the right term, but I see these terms like gluteal tendinopathy and other things. All I know is my hips hurt in ways they never used to hurt
Me
before.
too. Yeah.
And I have to do all kinds of extreme stretching and movement to keep my hips from being in pain. Pilates helps immensely for me.
Mhm. Mhm.
Reformer Pilates helps immensely for me.
Mhm.
Uh, but to strengthen that again. But I can't believe how severe the pain is. And it seems like there's a lot of talk on social media about this being a thing for perimenopausal and menopausal women.
Mhm. Absolutely. So joint pain, muscle pain in perimenopause, menopause is actually more common in some studies than hot flashes. So
Yes.
women will experience, upwards of 70 to 80% of women will experience hot flashes and pain edges hot flashes out by a few percentage points in a few studies that I've referenced. It's really interesting. We don't really make that connection, but when you think about it and dig into the physiology, our estrogen, progesterone, and also men's testosterone have an anti-inflammatory effect on our body, right? So they allow us, while those levels are what I call within the Goldilocks level, right? The level that's just right. They allow our body to have a natural anti-inflammatory mechanism, all through our lives up until, a menopausal transition when those start to kind of drop off. So then we lose our anti-inflammatory natural one of our anti-inflammatory or natural anti-inflammatory protectors, right, in regards to our hormones. So
Mm.
that's where then things that we were doing when we were younger, how we were eating when we were younger, didn't affect us as much because we had this own built-in way of processing that inflammation. also during that transition, because the hormones are changing, our gut changes as well. So the gut helps to metabolize hormones in such a way to get rid of excess that we don't need or recycle stuff that we do need. If we have less of those hormones, there's microbiome changes, which can perpetuate our hormone fluctuation faster
Sure.
than what it should be. And also the diversity of the microbiome helps to keep hormone levels in that Goldilocks level for longer. So some people will go through menopause without any hormonal issues. I was, knock on wood, my mom had horrible menopause, but I think because of all the work that I've done in my gut, the foods that I put in my body over the years, I really sailed through menopause. It's now at 58, pushing 60 that I'm starting to go, oh, my joints are, so now my hormones are in that, very low state where I'm doing things naturally, and looking at hormone replacement as well to help just give me that little bit of extra support. But my opinion is you shouldn't, in my opinion, doing hormones as the first line of defense just kind of covers everything up, right? And then we're not dealing with our gut, we're not dealing with our food. So utilizing hormones after you've worked on gut health, after you worked on foods that you're putting in your body, and seeing what you may be sensitive to or not, is a really nice way of addressing that pain overall.
I agree. That was my journey as well, to other hormones after healing the gut. What would you say? And again, I realize everyone is different, everyone's biochemistry is different, but what would you say are foods that you added in or focused on in your menopausal journey to heal or keep your gut in good condition?
For me personally, and I always say this is not necessarily that everyone has to do
Yeah.
this, because if people, whenever I say it, people are like, oh, well, you want everybody to not have that kind of food. That's not true. I'm just as
Right.
my personal journey. But gluten was a huge one for me.
Mhm.
So I had constipation growing up, and then I started to be able to regulate that with probiotics and things like that.
Mhm.
But what I would find is I would have this back pain down, and pain would go down my leg into my foot when I was standing and coaching or standing giving talks. And I was like, well, I'm a physical therapist, so I do my exercises to control it. But then it came to a certain point where I couldn't control it anymore. It was just happening. Went and got an MRI, had, 3 bulging discs. They said, okay, that's the problem. So I just kept on doing the exercise, but I still wasn't able to control it like I used to. Then lo and behold, I give up gluten, and all of a sudden the pain in my back and leg goes away. Is the
Yeah.
weirdest thing. And as a PT, I really had a difficult time wrapping my brain around that connection. I was like, wait, I don't have constipation anymore, but I must have some sort of leaky gut that's contributing, or that at least gluten irritates when I have it, so that
Mm.
causes inflammation in an area that's already injured on me. That's my, for lack of a better way of determining it, weak spot, where I can be triggered if there's significant inflammation. And sure enough, if I have those foods with gluten, that I regain or have those symptoms again. And I got cocky for a little bit because I was feeling really good. And I did a food sensitivity test, the ALCAT again. I think I did one 5 years apart. And it came up as gluten as only minimal of an issue for me. So I'm like, oh, I can have it every once in a while. Yeah, no, that I added it back in. It was minimal because I didn't have it for so many years. So tried to add it back in, and
Yeah, that's my experience with it too.
yeah. So gluten for me was one. It even created some visual changes in me. What people don't understand is not every piece of bread has the same amount of gluten or the same amount
Right.
of gliadin, the protein in gluten. So I'll never forget this one time I was going to visit my mom, driving like 14 hours, stopped at a restaurant, got a little breakfast sandwich with like an English muffin. This is again before I really was focused in, zeroed in on the gluten. And as I'm driving, all of a sudden on the right upper quadrant of my vision, the street signs were like all blurry. I was like, this is weird. What's going on? Do I have a tumor? What's happening? So,
Inflammation.
right. So
The
then
way ocular.
when I arrived at my mom's, it went away. I told her about it. She's a nurse. She's like, oh man, you need to get that checked out. Blah, blah, blah. Forgot about it because it didn't happen again. Had that same breakfast sandwich from the same place probably 6 months later. Went to Home Depot, and I'm checking out across from the person who is taking my money, and I'm thinking to myself, oh, I feel terrible for her. She's got this like like a distorted area on her face, made it look like kind of scarring. And then I looked at everybody, and everybody had that.
Oh,
So in my right upper quadrant of my vision again,
that is crazy how
yeah,
fast.
It was crazy. So I don't know what was in that particular English muffin, but either it was higher levels of gliadin that I didn't know about, or a different type of gluten, or something. But ever
Right.
since I haven't had it, I don't have that issue. So there's so many things that people think that there is, they take medications for, that if they would just look at their food, they'd be able to eliminate a
Oh my
lot.
gosh, couldn't agree more.
Mhm.
What's your stance? Any other besides gluten, any other foods that you've seen that have really made, and I know this is sacrilegious in Wisconsin, but what are your thoughts on dairy?
Yeah, so it is, cheese is like, talk about a connection, a comfort food for people in Wisconsin.
Sure.
So dairy can be an issue, I think, in more for people who we look at, let's say, women with endometriosis. We want to get rid of dairy, red meat, all those types of things that can be inflammatory. But I really then rely back onto the LCAT to be like, okay, so if we're thinking there's a dairy issue, is it the proteins in the dairy? Is it whey? Is it casein? Or is it lactose that the person's having issue with?
Right. Could
We
be.
get around some of the dairy restrictions. And the good thing about cheese, and there's a lot of good things about cheese, is that it's less of the protein in there that's the issue. And because of the way it's processed and fermented, it's more of the fats, which is
Sure.
not the greatest from a general overall health if you overindulge in that.
Mhm.
So it's less reactive for some people. So especially if the person, like some people, if I say get rid of dairy, they're like, fine, I rarely have it, right? So, but then some people, it is a massive part of their life. So we try to look at workarounds while we're getting rid of some of those, things that are, like, let's say cow's milk for whatever they react to. So we get
Sure.
rid of that, but maybe we keep cheese in for a little bit, and then we kind of
Yeah.
make,
Or different kinds of cheese, aged versus
correct.
fresh.
Yep. 100%. So then,
There's some folks that can do. I did fine on aged cheese.
mhm,
I do fine on aged cheese. And also it's something that doesn't really make me want to eat a lot of it. Like I can have a serving of it and move on and not really think about it. But if
right.
you put a softer cheese, a less aged cheese, um, even a more processed cheese with different ingredients in it, I'll want to
Like
eat
Velveeta. How do you
more.
feel about
No,
Velveeta?
Oh
no,
my God.
definitely not that. Definitely not.
We're
That's
up
not
on
cheese.
Velveeta, right? I mean, we used to have this noodles, chopped meat, and cheese dish, which was like gluten, like the red meat that I react a bit to, not much to, but I can't have a lot of it. And then Velveeta, and I'm like, I don't even know if that's cheese, but that man, that block, it tasted so good, and probably was the absolute worst thing.
Isn't that funny? That's the only thing that growing up Italian in New Jersey did for me.
Mm.
I thought Velveeta was like devil whole spawn. I was like, why do people like this? Like in craft cheeses, I was like,
Oh,
people
exactly.
have not had fresh mozzarella because they would not eat these cheeses if they had fresh mozzarella in their lives. Like I just, I didn't understand that. This Italian New Jersey girl. Paige, go ahead.
I tapping onto your cheese conversation, we follow Casey Means a lot, and her and her brother were talking about dairy. And they said it's not the dairy, it's how the cows are fed. And that if you
Well
find
said.
dairy where cows have been, grass fed and you're getting these organic products, that really there's not a problem with dairy. Do you go along with that line of thinking too?
I think that's certainly a part of it, 100%, that, how the cows are fed, that's what we're gonna be getting what the cows are getting, right? But I still think there is a personalized approach to that, that not everybody has to give up dairy completely, especially if they can find a source that's healthier and doesn't have all the, the
Yeah.
garbage in it, which is tough
Mhm.
to find these days.
Yeah.
But so I do think the personalized approach is more accurate for people, especially if they have difficulty giving it up. Or let's say they've given up so many things and they're so restricted in what they're eating, then we really want to get that food sensitivity to be like, what can we add back in so
Yeah.
that you're not completely irritated? Because I have patients now, two of them right now, that they eat the same thing every day, almost with each meal. And we know that the gut needs diversity. So, but that's the foods that they're like, if I eat anything else, I feel terrible. So we've really got to find the other things that they can have instead of just trying to eliminate everything.
That's right.
You're right, because compliance, I mean, nobody wants to be miserable and nobody is going to stick with that
Right.
forever if they're miserable. So that is a great point. I I don't eat much dairy, but I'll have a cheese stick or something if I'm on the fly but
Mhm.
I could take it or leave it, but I don't react to it. So I don't have much of a reaction, but it's a very controversial subject. Dairy really gets people
Really
the
is.
ruffles up for
Really
some
does.
people. I wanted to ask about, you said something earlier that perked my ears up. Was your statement that it's not necessarily aging that causes pain, but hormones, or was that the other way around? That it's hor- what did you say as we get older, if it's aging or hormones that actually are causing the
So
pain?
aging itself is not necessarily going to cause pain. There are plenty of people who are, 90 and 100 and don't have all the aches and pains that some people who at 40 and 50 have, right?
Mm-hmm.
So age in itself makes us potentially more susceptible to developing pain because of the change in hormones, the change in gut health, the change in and just our body in general over time. So I think we all just are like, oh, I'm going to get old, and old, being old sucks. And, we're just kind of resigned to the fact that we're going to hurt. And that's not necessarily true for everyone. Just like not everyone who goes through menopause has menopausal symptoms, right? Some
Yeah.
people go through it without any issues. So we know that
Adding.
menopause is not the
Yeah.
problem, but the transition into menopause can be associated with these symptoms when our body is out of balance underneath, once we take away those natural anti-inflammatories, and then all the inflammation from the things that we were doing that we were able to get away with earlier, we're not able to get away with as easily.
Mhm.
Hormones change.
You guys were talking about hip pain, and I don't really have, when I have the hip pain is when I lay down at night and I'm a side sleeper. So I don't know if that's what Jamie was talking about with hip pain, but if is that where you typically see people in our demographic having pain in the hips, is when you lay down at night and you're laying on your side, or is it all day long that they're
Sometimes, really depending on where it comes from, is how it manifests. So if you are lying, if you have hip bursitis, for example, which is a bursa is like a fluid-filled sac that sits on top of the hip bone called the greater
yeah.
trochanter, the thing that kind of pokes out on the side of your thigh on the upper part. And you lie on that, that can be painful. So then as a PT, I go, okay, so that's hip bursitis, but why do you have it, right?
Yeah.
Then I'll look at your biomechanics. How are you moving? Is there somewhere you're moving or walking or bending or exercising that's continually irritating that area? Because that's the trigger. I talk about triggers in the pain-free formula being tangible and intangible. Tangible triggers when I can see, I can observe, I can see how you move. We can correct that, take away that trigger. Just like if I scratch my hand, the trigger is me scratching it, right? And that's why it keeps staying red and puffy and not healing. But I take away the scratch, and the body has a natural healing process, so that in a couple of weeks I don't even see that scratch anymore because I've
Yeah.
removed the trigger. So in that case, if you always lay on that side and it's always sore, and I see something that we can change as far as biomechanics go, we use our soft wave therapy to decrease the inflammation. That pain line on your side should go away. Now it also could be coming from the back, so I'm just really simplifying it to just
Mhm.
hip. Now, if you have an issue like I had after I started to transition later from menopause, like in my mid 50s, I would go to bed at night and my hip would ache, and it wouldn't matter what position I was in, it would just keep aching, but it didn't happen every night. So then when I got my food sensitivity stuff and started looking at my food diary, I saw that every time I had red meat, my hip would ache. And it was on the same side, my right side, that I had all the other, issues that we talked about
Interesting.
earlier. So then whenever I eliminated that, I don't have that deep ache. So it could be that, also could be hormones. So kind of depends on how it presents, whether it presents during the day,
Mhm.
whether it presents at night, and is it there all the time? Is it there sometimes? Does it get worse? Does it get better? So those are all the things that I process in my brain if you come to see me for hip pain.
Do you want to laugh? Do you want to hear not a joke, but you want to laugh about what I do about it? I keep a tennis ball in my nightstand. And
Mhm.
so mine's on my right side too. I take that tennis ball out of my drawer and I stick it underneath my hip whenever I'm aching at
That's
night.
good. So
That's
you
my
can,
high tech.
yeah, that's a great, I'll talk to patients about that. That's an awesome way of dealing with it. And you might have some of the gluteal tendinopathy that Jamie was talking about before. And by putting that pressure from that tennis ball, you're bringing more blood to the area to help relax that area as well too. So
Yeah.
yeah, absolutely. Great. I don't know if somebody told you to do it or if that was just intuitive?
No, I just
Right.
intuitively like, can't stick my elbow in there.
Yeah.
So, and I want to go to sleep. And then I start getting restless leg and I'm like, oh man, this is not good. But
Yeah.
I'm like Jamie, where I stretch like I do pigeon pose and all that every single day. And if I go a few days without doing my foam
Yeah.
roller and those deep hip stretches, I pay for it at night when I try to go to sleep. It's misery.
Yeah.
Misery.
And things like if you were coming to see me, we would talk about magnesium, we would talk about,
Exactly.
I take magnesium
yeah.
and I do hormone replacement.
Okay. So we would talk about then checking what those levels of hormones are, making sure your body's metabolizing them the way that they should. So there's depending, like if we were having an evaluation right now, I'd be, talking to you about, okay, so these are what we've got to look at. We got to get these tests for the hormones. So if you're on hormone replacement, my biggest pet peeve with people who, well, there's two big pet peeves with people who prescribe hormones is number one, they don't do testing. They don't get a baseline.
Just do
So
symptoms.
they just treat with symptoms, which is medically acceptable now, which is floors
Yeah.
me
Yeah.
because as you know, as somebody who's used herbs and supplements in the past, we get all this crazy blame about how it doesn't work or accusations of how to there's no testing, and then that's what they're doing from a conventional medical point of view. No testing, just giving it based on symptoms. And if there's something wrong, we have no baseline to compare to. So
Yeah.
you test, you get the baseline. Then if you're not feeling well or you're doing the hormones and still having pain, we want to test those hormones to see so we have something to compare it to. The other
Good.
pet peeve of mine regarding the hormones is they don't consider how the hormones affect each other. So all the sex hormones come from cholesterol that breaks down into progesterone, which breaks down to cortisol, which can convert into testosterone and estrogen. DHA breaks down into testosterone, which converts into estrogens. All the different estrogens. And if we're low in it, they just go, okay, we'll give you progesterone, we'll give you testosterone, we'll give you estrogen, instead of thinking about, well, how is that all going to affect? Why would one be low and one be normal? Why would one be low and one be high? And then if I add all those hormones back in, how is the body going to process that? So looking at one thing at a time and then watching and seeing how that hormone, like DHA, could increase your low testosterone and potentially improve your estrogen. Or your testosterone may be low because your estrogen's too high and the body's trying to accommodate for that. So I think there just needs to be more thoughtful processing of what's going on with the hormones before a specific or a few specific hormones are prescribed.
And constant tweaking. I had the saliva testing, I had the blood and the saliva testing, blood wasn't accurate, saliva was. And
Ah,
I got all of the it took a long time to get the results from the tests. They did a full blood panel, I mean, God, pages and pages, plus the saliva testing, which told them even more. And then I had to wait for the compounding pharmacy to have an interview on symptomology and fill out tons of paper. I mean, it was a long process and got me to where I have the HRT now, but we're still, I'm talking to my compounding pharmacist once a month or every couple of months. We tweak it all,
wow.
we tweak it all the time. And
Yeah.
he's like, oh, especially as I was changing my diet and I was starting to heal from all of my inflammation issues. And he said, okay, we need to drop your estrogen down. We need to keep that the same. We need to add in a progesterone at night. We need to, he was constantly looking at different chess pieces, moving them around because, your body's not always the same. And I'm the kind of person that I like to, well, try to keep improving and healing my body. And as you improve and heal your body, especially with me eating more cholesterol, a higher fat diet, animal fat diet, lower carbohydrate and, moderate fiber, he was like, you're producing some good intaking and producing some good cholesterol now. That's going to change your hormone profile and your needs. So
Yeah.
I think that there's, to your point, Stacey, it is not one and done with hormones. You have got to be in good connection with a provider and hopefully a compounding pharmacy.
Absolutely. And then the other thing I'd suggest too is urinary testing, because what the urine does
Yes.
is tells us how we're metabolizing our hormones.
Yes.
So
Yes.
are hormones being are we holding on to too much of them? Are we getting rid of them too fast? How are we metabolizing them? And that just gives me, and metabolizing, basically how I explain to a patient is, if estrogen is a house of Legos. Each of those Legos is a metabolite of estrogen, right? So we either recycle them and reuse them in the body, or we get rid of them in the, fecal matter or excrement. So what we want to do is manage how we are metabolizing the hormones as well too, because if we don't, let's say we're metabolizing things too fast, we could take that hormone in and we're just going to do the same thing with that hormone that we've been doing with our own hormone, right? So it's really important to look at all those aspects to get a big picture. And you're right, it's not what we normally like as Americans. It's not fast and, here take
Right.
a pill and go, and everything goes away. And it shouldn't be, because hormones are very bioactive, right? They one little bit can really tweak a lot. So be more conscious of that and conscientious
Yes,
of how hormones affect each other.
yeah.
Awesome. This was great. Jamie, do you want to say
No,
anything to
I've
Chip?
got to run, unfortunately, but thank you so much, Stacey.
Yes, this is wonderful. You're a smart cookie. We appreciate having you. And again, check out the pain-free formula that is just out.
Mhm.
And we appreciate your time, and maybe we'll see you again. And
So-
until next time, you can find us at realfoodrecoveryforyou.com. That's the number 4 and the letter U. Thanks, guys. See you next time.
Thank you. Thank you again, Stacey. Take care, guys.